Which of the following is a generalized seizure disorder characterized by lack of a postictal state? A. Atonic seizure disorder. B. Clonic seizure disorder. C. Myoclonic seizure disorder. D. Temporal lobe epilepsy. E. Tonic-clonic seizure disorder. Answer. A. Atonic seizure disorder, also known as atonic drop attack ictus, is notable among the generalized seizure disorders because of its lack of postictal state. Postictal states may be seen following tonic-clonic, clonic, and myoclonic seizures. Temporal lobe epilepsy is a focal, instead of generalized, seizure disorder. What is the most common metabolic cause of seizure? Activity. A. Hypercalcemia. B. Hyperglycemia. C. Hypermagnesemia. D. Hypocalcemia. E. Hypoglycemia. Answer is E. Seizure activity secondary to metabolic derangements is most commonly caused by hypoglycemia. The only treatment required in this situation may be intravenous, 4-glucose. Prolonged seizure activity may also cause hypoglycemia, so that the cause and effect relationship may sometimes be reversed and further therapy may be required. A 15-year-old girl is brought to the emergency department for evaluation of a recent seizure. While awaiting laboratory results, she begins to have further seizure activity. Which of the following is the optimal first-line agent to terminate her seizure activity? A. Fosphenytoin. B. Lorgepam. C. Phenobarbital. D. Phenytoin. E. Valproic acid. Answer is B. Benzodiazepines are the optimal first-line agents for stopping seizure activity in patients of all ages. Available agents include lorgepam, diazepam, and midazolam. Phenytoin is recommended as second-line therapy for adults with persistent seizure activity. The prodrug, fosphenytoin, can be administered more quickly, can be given intramuscularly, and has less of a tendency to cause hypotension. Second-line therapy for children is phenobarbital. Third-line therapy is pentobarbital, propofol, or a benzodiazepine infusion. Valproic acid should be considered for patients who are on chronic valproic therapy and whose levels are subtherapeutic. A mother arrives with her 10-year-old daughter, 41 kilograms, who has been seizing for at least 10 minutes. The patient has a history of epilepsy, and a home dose of rectal diazepam has been ineffective. The mother states that the child has been in her usual state of good health until the seizure began, and there has been no history of trauma. Which of the following is the most appropriate initial action? A. Administer 10 mg midazolam intramuscularly. B. Consult neurology to obtain a bedside electroencephalogram. C. Endotracheal intubation with vecuronium and etomidate. D. Establish vascular access and administer 2 mg of lorgepam. E. Obtain an immediate computed tomography scan of the head. Answer is A. Early, aggressive benzodiazepine administration is associated with decreased morbidity and mortality in status epilepticus. Intramuscular midazolam is superior to intravenous lorgepam. In addition, the dose of lorgepam is inadequate. Endotracheal intubation may ultimately be required, but is a secondary priority. Use of a long-acting neuromuscular blockade agent, such as vecuronium, should be avoided. Cranial computed tomography may or may not be needed in this patient, depending on the response to benzodiazepine therapy. Bedside electroencephalograms are most useful in diagnosing non-convulsive status epilepticus.